Athens, Clarke County is home to an eclectic art scene, a diverse population, and of course the University of Georgia. But many of Athens' full-time residents are poor, and poverty contributes to a host of health issues, including limited access to care. The students and faculty of Athens' new medical campus aim to change that. In the following short films, produced by University of Georgia's Health and Medical Journalism graduate students, representatives of the medical partnership between the University of Georgia and Georgia Health Sciences University, as well as representatives of Athens' medical community, explain how having doctors trained in Athens will better the lives of many living here. The first video, Growing New Doctors, poses the question, how is the medical community in Athens, Georgia responding to the opening of a new medical campus?
We will look back in 20 years and say that the seed that was planted here with the wisdom of the Board of Regents and others here in the state, what will usher forth will be profound. It will blossom in the years ahead.
Could be so important for UGA, I mean, in general, and MCG, but it's really got to be looked at the way it was initially talked about, which was a real partnership. And I think the unknown now, which you need to put away for 50 years, is how the new president of MCG is looking at this.
President Adams and the former president of the Medical College of Georgia, President Dan Ron, met to discuss how we could increase the number of physicians in the state. At that time, we still are the 9th largest state by populace in the country. And at that point, we were ranked 37th in terms of the number of physicians per 1,000 people.
If you want doctors to stay in your community, the best way to do that is to train them in your community, so that 50% or so of residents end up going into practice in close proximity to where they trained.
I think the medical school, the biggest thing that it will add is just excitement among the medical staff, and it'll integrate with the community. But there's a real excitement right now with the medical school coming and physicians wanting to teach. And that takes some work, but it takes us back to our roots when we were medical students, and it's fun to go back to that.
My understanding is that we'll continue to follow the model of the Medical College of Georgia in Augusta, which is once the students start their clinical rotations, I believe they're assigned to a particular regional campus, and that could be throughout the state. So I don't believe our students are necessarily tied to the Athens campus for the whole 4 years.
The biggest question is, where do all the monies come from, the funds, to do this? Because you can't be spending a lot of time teaching if you're not getting some help, some reimbursement. So I think that's going to limit the amount of teaching an individual physician can do. Although physicians love to teach, there's a certain limit on how much time you can spend. There's the practical issues too that often aren't thought about. Where do you house them? On-call rooms, a library space, feeding them, the fact of what will the hours look like because they've been cut back.
The medical students spend 2 years doing their core curriculum, which is over the medical school. That doesn't mean they won't come here occasionally, and see patients for learning how to do physical examinations and interviewing skills. But when they go into their 3rd year and they start doing what we call clinical clerkships, then most of that teaching gets done by residents. So we probably will not be able to have a residency program fully going in 2 years when the students start doing that. So we'll have situations where they can be attached to one of the staff physicians, or most likely attached to the hospitalist program.
I think that it's important to get to the bottom of why people went into medicine in the first place, and to continue to nurture that through their educational process.
How do we move today to value not just the science of medicine, but also the art? And you can say that in different ways, but we think of science as the technology and all the information that has come forth, but that's sort of a head-focused thing. We've got to have the heart-focused thing too, and I think that comes in the art of medicine, where
it's all about relationships, and you've done
It
that so
is.
well.
And in the ICU, we're dealing with end-of-life issues so often, and patients that are dying. Being able to comfort the families, help the patients make the decision that's best for them, doing palliative care, those are hard things to deal with, and they're issues that have to come from the heart. Because you can have all the knowledge, but can you get that knowledge across in a compassionate way? And it takes a mentor and time to learn all those techniques.
And in the past, it was not taught well in medical school. I think that that is, in fact, being addressed here in Athens, and I'm excited about that.
And I also think that, which is something that I understand does not actually occur in their educational process, teaching them how to make a living with their knowledge when they get out of school. You know, having an understanding of the fee-for-service structure and having an understanding of how to move into a credentialing process with the insurance companies. That whole process, it takes a long time to do. And you cannot make a living if you're not on the insurance plans. You cannot make a living if you don't understand the value of your services and how much each service brings into your practice.
You can be a good practicing physician, but you may not necessarily be a good teacher. At the medical school, courses and seminars will be offered. I participated in one through MCG, Dr. Albritton, to help us be better teachers, to evaluate the student better. How do we integrate them into the working morning rounds, for example, in the hospital? How do we critique them? How do we give them feedback? We need to stimulate them, they need to stimulate us. But that feedback and that give and take is very important. There's an art to that. We need, as practicing physicians, to be brought up to date on some of the better techniques, some of the better ways to engage not just the patients, but the students that we're trying to teach.
That's a whole area that needs to be developed, and we're not quite sure how that's going to evolve, because you need quality residents. We've got a quality institution at both St. Mary's and Athens Regional, and we're trying to sort out in our mind's eye how that's going to best fit into the program. We're not sure. We'd like to know.
That always was one of those questions that no one knew the answer, is how the hospitals in Athens would respond to having a medical school campus in Athens, which needed those hospitals, absolutely needed them, because without those strong ties, you can't educate medical students.
Yeah, it's a multifaceted picture. It's the sort of, how best to say it? I think that everyone conceptually wants it. The details have to be worked out because we're walking into uncharted territories. We are community hospitals that have not experienced an academic setting where residency programs have existed. So we have to make that leap. We want it to be quality. We know the end point, which is, if we look back 20 years from now, there will be those that have said, oh, the wisdom that was shown by those pioneers that said somehow we're going to make this happen. There's the financial bridge to have, and it's almost a chasm in today's economy, to have to jump to get to. There is finding the physician teachers that are interested, although I think that will come. And then there is the ability to attract the quality residents that are needed in this town where quality medical care is given. So it will all come together. We're not sure how it's going to happen, but I think we all have faith that it must happen for the future, and so it will.
And we're planting the seeds, and we're excited about it. But we won't be here in 20 years to see where it's going to grow, what we'll have, but I think it'll be exciting. I do. That I believe deeply.
Yeah, I concur. I think the legacy of the seeds that we plant will bear fruit in years to come in ways that aren't even imagined today. It's exciting times. It's exciting experiments that are happening here in Athens, Georgia. The nation is watching. It's going to be good.
Athens-Clarke County is one of the poorest counties in Georgia. Therefore, the need for accessible health care, such as that provided by Athens Neighborhood Health Center, which recently celebrated its 40th anniversary, is that much more crucial.
It was challenging. We were playing with a lot of odds and we were working with a lot of challenges. And the fact that we got it started was almost a miracle.
They had a little modular unit on Berlin Street where they delivered health care. And now look at us today, 40 years later, in a state-of-the-art facility, having 2 locations and having served the community for 40 years. And it went back to a kitchen table of some advocates in the community, and they're not feeling served by, at that time, the present medical community. You know, they were told or basically made to feel that they only could go to like a health department or somewhere and be seen by a mid-level individual, but not by an actual physician.
I was over at the University of Georgia Student Health, and I heard about the group of people here. It was in those days, it was called Model Cities Health Clinic. And it was a part of the government program at that time of going around and going into neighborhoods and trying to revitalize, and they were putting money into public housing and revitalizing neighborhoods and trying to support small businesses. And so part of that was to develop a Model Cities Health program. Now you know how the government works. It doesn't.
You had several people who just said, well, no, we deserve this and we're going to go after it.
The mission of the Athens Neighborhood Health Center hasn't changed. We are here to provide high quality and compassionate primary health care to anyone who seeks our services. We have a special mission to care for those who happen to be underserved in our community.
For the people that don't have health care and insurance, it's very helpful.
Well, I came to Athens Neighborhood Health Center 24 years ago with the National Health Service Corps obligation. It has been rewarding to be able to place people on a sliding fee scale and provide full, comprehensive primary health care.
He's been through 2 heart surgeries with him. He had his last one in 2009, and she was right there. And I couldn't ask for a better doctor.
We have a second site we call our East Athens Satellite Facility that sits in the Marion Moore Community Service Center. My vision is to see this community effort continue to be a vital part of the healthcare delivery in Athens-Clarke County. For that to happen, we will need improved support from other entities like our hospitals, and definitely with the University of Georgia and the medical partnership. There will have to be a better collaboration and support of the services, both on our end and theirs. There has to be a respect for the needs of the community in order for that to happen. And I am hopeful that that these relationships will continue to build and grow. After 40 years, still excited, still much work to be done, but we are not going to tire in well-doing.
In the next video, Paige Mercer Cummings describes her work as Executive Director of Athens Nurses Clinic, a member of the Georgia Free Clinic Network. Institutions like Athens Nurses Clinic provide long-term health care to indigent and uninsured populations.
My father was a physician in South Georgia, Brunswick, and we had a little farm up the coast in Darien on the ridge. And on Wednesdays and Saturdays, when Daddy would go up to plow his little farm, there would be a lineup of people where the caretaker had said Dr. Joe is coming. And I got to play his nurse, and he provided the only medical care that was available at that time in McIntosh County. When he died, and then I went on to nursing school, I joined the Navy so I could see the world. And when I retired, I came home to Georgia, and I was doing some volunteer work through my church, and it ended up coming over here to volunteer as well as at Our Daily Bread, which is a local soup kitchen. And 2 years ago, when they did some restructuring, the board asked if I would consider taking over as the director, and so I did. My name is Paige Mercer Cummings, and I am the director of the Athens Nurses Clinic here in Athens, Georgia.
Before I started volunteering here, I had never really worked with this population. I thought I had, but I really hadn't. It requires a certain change in your own mindset, because you have to go from thinking, well, why aren't they following their dietary rules? A diabetic, why aren't they following their rules? Or hypertensive, they're supposed to be eating this kind of thing and doing this kind of thing. Well, when you have no money, it's hard to eat good. We have to change our mindset. I remember when I was a student and somebody said, well, you know, soap is cheap, why can't they at least be clean? Well, we have people who don't have a place to go to bathe. And soap may be cheap, but cold water is not comfortable when it's cold in Athens.
I've never worked in an indigent clinic, so this is like an eye-opening experience for me. And I've always told myself that if someday that I wanted to open a clinic like this, I wouldn't know how to do it because of my experiences here and because of working with Paige. She is, sometimes people, like, we don't realize how much she does because she does a lot of it in the background. Like, we'll be, like, you know, busy with doing stuff and with the charts and the patients, but you know, she's the one out there shaking hands with people and getting our name out there so we can get increased funding, increased exposure.
I go to Athens Area Homeless Coalition meetings every month. I go to the Arch Foundation meetings every month. That's the Athens Resource Center for the Homeless. I speak at churches. We gather supplies from places that donated, and sometimes we have so much we reposition it to other places again. And pass this on to MedShare, and MedShare is an organization in Atlanta that will come and pick it up and then put it out to other agencies.
She's just a very, very busy person. I don't understand how she runs the clinic, and then she has about 2 or 3 meetings a day afterwards because the clinic is a free clinic and you have to go find money. So Paige has to go to meetings, have to go to conference, has to go find money, and it's a 2 or 3 person job, in my opinion. She works 14, 15 hours a day.
I didn't really want to come back to work full time, and this is supposed to be part time, but it's really more like 60 hours a week. But I wouldn't turn it down. You have such a good feeling when you've helped somebody. And when I worked for the Red Cross and we drew blood and we knew it was helping somebody, that was good, but it's a different feeling. Here you are one-on-one making a change in somebody's healthcare status. And you can't leave without a better feeling than that you have made a change in somebody's life.
Another population served by the new medical students is Athens elderly. In the following segment, Athens Community Council on Aging, Sarah McKinney, shares why she's motivated to make a difference.
I remember very clearly meeting with a social worker at that facility at the time, and I knew nothing about social work. I was a 19-year-old, and I remember feeling as though we were not being heard as a family or being listened to, and just kind of glazed over. And that is exactly the moment I meant to become a social worker and changed my major from education to social work. You can't say enough about them being exposed immediately to what the community needs are. And where older adults are certainly not the only community need, they're a very important part of who we are as a community. And so getting the medical students out there first and foremost, I think is going to really have a lot of long-term benefit to their profession, to their impact on their profession, and to the community they serve eventually.
Sarah is, for me, I would say that the first thing that comes to mind is family. Not just her personal family. She definitely is a mother and a wife and a sister and a granddaughter, but she really looks at everybody as her family.
We're all individuals, and I will never forget that. And I hope the people that I work with never forget that, because when we quit treating the individual, we've quit treating the problem.
If she thinks there's a need or a concern out there, she's going to voice it. She's that person at the front of the room that will not let a worry or a concern die unless it's been addressed.
The most rewarding aspect of my job is not so much a sense of completion, but a sense of having again made an impact somewhere, be it small or large, in a group setting. I very much feel that approach to working with populations like older adults or populations at risk in general need advocacy, need community efforts, need people working together.
She has a vibrant personality, she's got a lot of energy, and she's well suited to work with volunteers and students and interns in our agency.
I think what drives Sarah the most is she wants people to be happy.
What motivates me daily in the work world? It's very easy, people. And I know it's a very generic, blanketed statement, but having an impact on lives, having an impact on your own life and doing the work that you do, it speaks for itself. I always say going to work at the Council on Aging is like going to church, because you're doing something that makes a direct impact on the community.
Well, I think she just has an aura of her being a positive attitude. And I think she gets them excited about what we do here. She loves her job, and I think it rubs off on the energy that she has on working with people, and gets them really excited and engaged in what they're doing.
The first thing that you need to do is understand the context of the community you serve. Where are you? Who are you serving? What is the majority of people you are serving? What is the majority of their needs? What are their barriers to education and health care and equitable access to goods and services? And in that way, when they're sitting on your patient table, or they're under your knife literally in the surgical room, or when you're writing their prescription, you make him see them as more of an individual, because you understand the context of the community you serve. Just like we're all individuals, no one community looks the same. I want to be remembered as somebody who had a damn good time. That's it. Somebody who had a damn good time and who had a good heart doing it.
It takes resources like money and space to allow medical students to practice in Athens' various clinical settings. In the following video, the Medical Partnership hosts a golf tournament to fund a student-run clinic at the Mercy Health Clinic.
I kind of wanted to continue efforts giving back to Athens, because I've been here so long, it's kind of like another home now. And so I approached Dr. Steyer about it at the beginning of last year, and he told me about the Mercy Clinic, which is something that they had been wanting to start for us, because it was the quickest way we were going to be able to start doing outreach with the community.
Every other Wednesday night, a bunch of students get together, and our professors volunteer their time as physicians, and we provide health care to local people who would otherwise go without. We thought the golf tournament would be a fun thing for people to do, and it would be worth the cause. So
it's definitely worked out really well. We raised a lot of money. It's going to go towards a good cause here at Mercy, but yeah, it was a lot of work.
So the organization of the tournament kind of started with an idea that one of the students had, just saying, hey, that would be a great fundraiser, and we kind of jumped in blind. We didn't really know what we were in for, and it was a lot of work, but I do think that it's turned out we're here, it's happening, so.
Mercy's been really nice in letting us use their facilities to help reach out to this patient population. About 32 of the 40 students in our class, though, are interested in working or have been working with us.
I can really tell that the students just enjoy being here, and it's been really great having their medical background also in every position. It helps me, because sometimes I have questions I can ask them.
We wanted to be able to raise funds. Specifically, we want to have supplies to run the clinic, but we think that it's possible to do kind of something bigger, like they are down to one functional scale or something, to be able to give like a big ticket item that we wouldn't use up, that the clinic would be able to keep and use.
Well, I know that we've been doing a lot for the clinic. I got to talk to some of the people who work on Thursday night this last week, and I talked to them, joked about how we have about 6 patients and how they can handle about 18 patients in a night, and they actually told me that they notice the difference that we've been making for them on their patient load.
It's just a calmer clinic because we have less patients scheduled right now than our regular clinics. So for instance, tonight we have only 7 patients on the schedule, whereas a normal clinic night we have anywhere from 14 to 21, or sometimes even more than that if we have a specialty clinic also. So it's less hectic.
Even though the patients that we see at school are trained, and it's still artificial. So here you're getting with a real patient, you get real reactions, you know, there's real feelings involved, and it feels a lot different.
I'm actually, this is my second time at Mercy Clinic today, and I love it here. It's something that we get to do. It's like outside of the class study that we do, this is the real patient interaction. And so this is what we're here for, and it's very meaningful.
Usually you see something here that we're learning about in school or have learned about in the past couple weeks or months. So it's nice to actually see a patient with what you're learning about.
Mercy has kind of a limited number of drugs, not like a regular pharmacy, but they have, you know, they cover all the drugs you need, but it's an opportunity to go back and talk to the students about this drug and how the drug works, and then you can see the lights come on when they realize, oh, that's when we were talking about, this is what happens in the kidney, so this is the drug that works here, and this is the drug that works in the heart.
Whatever we're studying in class, I see those drugs written down, I see those syndromes, those diseases that the patient comes in with, and so I'm sort of able to take the theory part of it and put the practical part together and make a whole story out of that.
The medical campus in Athens is only now in its 2nd year, and already it has provided students with the chance to change lives. This kind of medical education takes students from the classroom to the heart of a real and sometimes troubled community. I'm Marcy McClellan, and this has been the Medical Partnership, from the classroom to the community.